should do that. So unlike a mystery novel where you have to wait for the answer until the last page, I'm going to tell you the good stuff right away, and then we'll provide the background as we go through some of the data. This way you can be thinking about how does this impact me as you look at the stats and the tables. And if you need to jump off the call for any reason, or you want the report or copies of the slides, just email me or the chamber, and my email you can see is in that lower left-hand corner there. So in our survey of about 1,200 adults in Northwest Ohio, only 36% said they're ready to return on opening day to public places such as libraries, zoos, play gyms, play areas, movie theaters, places like that. It's going to take a few additional months before these venues see over half of their regular users back. A full 1 out of 3 who visit these venues said that they do not know when they'll be comfortable making a return visit. These results send a very strong message to venues, service providers, and retailers that visitors and customers will expect safety measures in place. It will not be business as usual. This is probably the key discovery. It won't be business as usual. So we have to think outside the box on how to make customers okay with the new unusual. And I do believe that as businesses and public places give the consumer confidence that they'll change their attitudes about exploring what you have to offer. So as we said, these statistics are a snapshot in time, and there's opportunity to change opinion. Customers are most likely to go back to personal service providers as soon as they're allowed. And at least they are least likely to go back to the events at the larger venues. Throughout the whole data set, a consistent thread that we've seen is that people of color are less likely to immediately use these services compared to whites. So let's get on with some actual survey results. So if you look at the list here, the largest percentage of people who will visit the beauty shops, barber shops, and others in this category is the 59% who will go as soon as they can. So for some of us, these might be perceived as the more essential visits. A huge gap exists between personal services and public places. As you can see that 59% will go to personal services, but only about that 36% are interested in going to the public places that are listed there. So if you look, you can see that the pattern is kind of clear. The more people that might be expected at a location, the less appealing those locations become. Only 1 out of 4 who has used childcare will be dropping their children off as soon as it's feasible. So this may be a function of extended opportunities to work from home, or maybe even the need to stay home with older children who don't have the option of attending school. But regardless of the reason, it's going to be a challenge for childcare providers to rebound quickly from the impact of this pandemic. But then on the flip side, does more family time or more time in the home, etc., create any opportunities for your business? Looking further down the list, you can see that transportation services are also going to be slow to respond. Their rebound is going to take a little more time. And if you think about it, this isn't necessarily a function of more people at any one point in time, but it's the turnover of people. How many different people have touched the door, touched the seat, touched the armrest, touched the locks? How many different people has the driver been exposed to? So even though you might not be in the busing or transportation industry, if in fact there's a perception of a lot of turnover or exposure of your staff to a lot of people, that might influence confidence levels. The last on the list is those large venues. They take the biggest hit of how quickly somebody might return. The impact on these events, from college sports to resort locations, is that tickets are purchased in advance. So if consumers aren't confident about when they'll be comfortable returning to these large venues, they might not be comfortable buying tickets to other things, which has the ripple effect of not making other purchases that are associated with major outings. And you can assume that this fear of making these long-term commitments to a venue spills over to fear of making plans for future travel, future vacations, things like that. So even if the hotel is open or the city that you're going to is drivable, the question becomes, will there be places open and desirable to visit when you get there? But again, I look for opportunities. So does this stay closer to home or, do more last minute fun things? Does that create opportunities for your business? The upshot of the story is that consumers are just not feeling confident. So the burden is on those who serve the public to give them that confidence that their health and safety is a priority. Restaurants will need to implement significant changes to make patrons feel safe when they come in for a sit-down meal. Social distancing, sanitizers top the list, but more than half would expect staff to be wearing face coverings and gloves. Access to safety products combined with limited seating is going to make it challenging for restaurants to make a financial rebound when the dining areas open again. That number at the bottom, that 16% who say they don't expect any changes in the restaurants, the majority of those are the adults who are under the age of 35. If you've been listening to the news, the governor just announced that on May 15th, the outside dining restaurants and bars can open, and on May 21st, the inside dining restaurants and bars can open. But of course, they have to be redesigned for social distancing, etc. So for me, I sit back and I look at this list of expectations. So put this in context that people visit restaurants and attractions to have fun and relax. So while the staff is wearing gloves and face coverings, the atmosphere still needs to be welcoming. So for me, I look at this that at no time in our history of researching consumer attitudes has been more apparent that businesses are expected to put the customer first, not just with good service, but with overt attention to the mental and physical health of the guests. The challenge is going to be to put these safeguards in place while still safeguarding your brand. And you need to be offering a memorable customer experience. I'm saying positively memorable customer experience because they need to share their positive experience with others. Even with the pandemic, the power of social media still reigns supreme. So here, when you look at what's expected in our public places, 3 out of 4 who visit public places will expect access to hand sanitizers and a commitment to social distancing. For many establishments, the challenge is going to be how to accommodate some of these expectations within the physical design of the building. I mean, some of it might be impossible to provide the safeguards for employees and patrons within the current business model. But we can look at these social pressures and consumer expectations from the positive perspective. It might be the prompt to begin thinking outside the normal business model to figuring out how you can meet the needs of your customers or the public using your place. Maybe there's some creative solutions out there. Maybe more services can be conducted by phone or text or online. With some brainstorming sessions with your staff members or even some customers, it might be possible to still provide your products and services using some innovation delivery methods. And don't think about delivery as in physically a delivery truck going out there. Think of delivery in that sense of delivering the benefits of your product in new ways. Community members returning to their gyms and fitness classes have heightened expectations for sanitizing the equipment and all surfaces and social distancing. These expectations come with new challenges for the gym operators, but especially to train the personnel and your participants on the new protocols. Fitness centers and similar businesses are going to have to make more of a show of their sanitizing efforts. So those cleaning efforts that you routinely did behind the scenes should now maybe be done in front of customers, because it might be more effective at making those customers feel at ease if they see the cleaning process. This might be true of other public places where a lot of what you did happened before or after opening, but now it might be better to let your customers and let the public see all the efforts that you're taking. You can see from these percentages that customers have higher expectations of a fitness center type place relative to a library, for example. So if your business is perceived to fall into this type of a category, I think you might assume that expectations will be a little higher. And it might be, possibly, that just in the early stages of opening public places, some people aren't going to feel comfortable in your business. So realistically, it might not be enjoyable to go running on a treadmill with a face covering. So potentially a certain segment of your members or of your customers might not return right away. There are also some types of decisions that businesses have to make. Potentially, some of the measures necessary aren't consistent with how the business operates or the reasons people use your business. And it might simply be okay to cater to those who are more able to come out and use your facilities in the ways that you can offer them within the guidelines. As we said, only 16% said they would return to those large venues as soon as they open. Over 1/2 are unsure when they'll feel comfortable returning. But when patrons do come back, they'll expect more space between them and their neighbor, and along with sanitizing products readily available, 2 out of 3 expect limited ticket sales. So not only will this require extensive inventories of supplies, but also necessitate employee training on how to use masks and gloves correctly. This is true of many businesses. Before the doors can open, protocols will need to be written and employees will have to be trained. And even though the guidelines are being issued, it still is going to require each business to interpret those guidelines to how they're going to work in their physical business. Since my focus is always on collecting opinions, I would encourage businesses to enlist the help of their employees, or maybe even some key customers, to help develop systems that instill confidence. So this is a listing of healthcare services that were postponed. But in terms of other professional services, I think many purchases and appointments were put on hold. Potentially, if your customers put purchasing your product on the back burner, you may need to create some strategies to prompt some action. It might not necessarily require a price promotion. There might just be some creative messaging to your customers or reminders about what they're missing. From the seller's point of view, we need to be sure that our customers don't forget how important we are. So just because they did without does not mean that they should continue doing without. So these stats talk about healthcare, but the underlying story here is relevant to other industry sectors. The fact that only 9% of people who needed medical attention did not get the medical care that they needed means that most people found a creative solution to get care. This led them to using some tools that we've been able to use before, but chose not to. For example, you can see on the right-hand side, 38% used telemed or telehealth to chat with a healthcare professional. This has been available for a long time, but current circumstances caused people to try this service, and now many are continuing to do so. Others were messaging their healthcare professional. Again, this isn't something new. They could have been doing this before, but now that we've bothered to figure it out, it might be that whatever barriers existed and reasons why these weren't used before, some of those barriers may be reduced now. So again, I would think about your business. Have you offered some service that's been hard to get people to try? A service that maybe you didn't get the traction you expected? Maybe this is the time to take advantage of consumers' willingness to try new ways to meet their objectives. So on the left-hand side, you can see the services used during the pandemic, and on the right-hand side, the percentage who will continue to use these services post the pandemic. The stay-at-home request really encouraged some community members to try new services and use their home for socializing and exercise. More importantly, these data show that post-pandemic, many Toledo area residents will continue with these new habits. The new normal may not just include gloves and face coverings. It may actually include a much higher propensity to spend less time shopping and more time on virtual visits. From your business perspective, it would be great to think about the new ways consumers are doing things and see if you can ride that wave. For me, the fact that more people are comfortable with video chats like this one opens more opportunities for me to conduct research using these platforms. We had tried it before and thought about it before, but a lot of people were so concerned about how to use it that we weren't able to get a lot of traction. So the real story here is that at least 2/3 of those who have tried something new are going to continue with these new habits. I truly believe that when the economy is, quote, back to normal, it will not be the normal that we had pre-COVID. It'll be a new consumer that we're serving. They'll have heightened expectations on many fronts, not just health safety issues. Today's consumer has seen how creative businesses can be, and they will expect businesses to be responsive to the next challenge. Just think about how many really creative solutions businesses employed to make using their products convenient in these crazy times. Consumers will expect the same level of responsiveness, and they're going to expect it even faster next time, dare I say, if there is a next time. So let me leave you with this thought. First, you can't see your business from the consumer's perspective unless you really make the effort. We are way too close to our businesses. Second, we can't know the customer experience or the customer journey because we serve people who have experienced this pandemic in many different ways. Those who have lost a loved one are taking this journey very differently than those who didn't need to even change their lifestyle too much. So I look at these data as saying that consumers are concerned. They don't understand this virus, and they're looking to businesses and those operating public places to help them return to the lifestyle they enjoyed, but they want it on their terms. So here's an exercise you can do. Think about the customer journey. This creates opportunities to make an impression. The good, now's the time to make an incredible impression on your customers. I'll give you a hint though. Don't come out with a commercial that says, we're all in this together. There was a national survey that went out that said that Americans are completely sick of that slogan. In their minds, they hear, we're all in this together, but there's nobody else sitting at their dining room table trying to figure out how to conjugate verbs in French or help them with their 6th grade science project. So they're not necessarily feeling like we're all in this together. They're really thinking, what are you going to do for me to help me get through this? So if you think about their customer journey, you've got to put your hat on as the customer, client, or the key constituency group. And here's where it starts. First, they get the idea that they need your service. So during these times when you've been out of touch with your customers, don't let them forget about you. Once they get that idea, it leads to an experience, some kind of customer journey, and they want a safe, clean customer journey, however you can create that for them. So the first point of contact typically was physical contact, but I sort of grade that out because maybe the first point of contact won't be physical contact with your business. The interaction with an employee may not be an employee. It might be some kind of virtual experience. How are the other patrons going to fit into this? You've got to navigate around other people potentially. So putting yourself in the customer's position of how they're going to get in and around and through your doors and out your doors if other customers are going to be there. And then there's various surfaces. Will there be products that they touch? Should it be behind glass? Should they get more help from somebody who's working there? So how they actually handle using your facility may or may not continue to be the same. And then there's the transaction, the money transaction, but doesn't need to be a physical transaction. There are virtual ways now to share funds and move money around. And then, of course, we've got that final evaluation. Now that they've come to your facility, that final evaluation is what starts the process again. They have to have had a good experience so that next time that need arises, they think of you. Here's another way to look at your customer's journey. Think about how they enter the door. You may be surprised at the absolute creative solutions that you've already developed or others have developed to help them get in the door, enjoy their experience, and out the door. Just a quick comment, as I was talking to my staff about the data that we received back, one of our employees said something about the fact that he didn't really want to be given a disposable menu. He would rather order his food looking at his phone and maybe even send that order directly somewhere into the kitchen. And I'm thinking about it, well, of course, the concept has always been that the waitstaff comes to your table, or whomever comes to you at the physical location, and they try and provide you assistance. But maybe today we don't want to be face-to-face with somebody or mask-to-mask with somebody. So if you talk to your employees and customers and you just walk through that journey a couple times, you may actually find out that there's a lot of things that you could do to really reduce that feeling of distance between you and your customer, but still provide a really great service. So some of these things that you might come up with, I think you're going to be surprised that you'll want to continue doing them because they actually improve the overall experience or bring a new element of your brand to light to the customer. So that is the story that we have learned from Toledoans about rebounding from COVID-19 and how they will get back out into the community. So if you have any questions at all, I think we have time. I can take them, or as I say, my email address is showing and my phone number is showing. So you can always email, and this presentation along with the report will be available also through the chamber or through me. So it was a pleasure giving you a peek through the lens of the customer. And if anyone has a question, I would be more than happy to take it. All right. I would assume you're so excited about all these new things you're going to do that we should move right on to, again, just offering if you've got questions, you can certainly email them, and we will definitely have the material available through the chamber or through Great Lakes. Julie, did
Thank you, Lori.
We wanted to add?
Yeah, no, I just wanted to say thank you for sharing that great information from the eyes and the expectations of our community as we open up. I think maybe some of us heard for the first time in your presentation the governor's recent, very recent timeline for restaurants opening up. So thank you for sharing that with us as well. Again, it's a great perspective to know, and that snapshot can really give us all some ways to think, when we come back to doing business.
All right, well, be safe, everybody, and good luck with navigating these waters.
Thank you, Lori.
All right.